Let's take up the image based questions. The foramen of Winslow. What are the boundaries of the foramen of Winslow is one of the very important topic. We have portal vein, common bile duct, hepatic artery, and we also have inferior vena cava, aorta among the anterior boundaries. So that's how the foramen of Winslow is typically located. The various surfaces of the spleen. Spleen has got a gastric surface where the stomach basically comes and abuts, which is called the gastric surface, and this is the place where we have the lesser sac related anatomically is what need to be remembered. Can the online students can punch whether the voice is loud and clear, doctor? Now, what is the area of drainage of the various lymph nodes? Some of you are going to become top surgical oncologists. You are going to operate on gastric carcinoma, which is not uncommon. So you must know the lymphatic drainage of the stomach. So we have got this area 1 which basically drains along the right and left gastric vessels to the aortic group of lymph nodes. Then we have the area 2 which will go to right gastroepiploic, and area 3 is the one which is given in the image. Now, what is the most common position of the appendix is a very important question. I am very happy to see 20 plus online viewers today and many more from the home. Yeah, so you should remember, doctor, retrocolic, retrocecal are the classical locations. 75% of times you will find the presence of the normal appendix is what need to be remembered. Then the various lung volumes. What is meant by functional residual capacity? If you do forced expiration, still some air remains in the lung, which is basically called residual volume. So if you combine two volumes, you basically get a capacity. Capacity is 2 volumes. Just like in ECG, what is an interval? Interval is a wave plus a isoelectric segment. Together is called wave. PR interval means beginning of the P wave to beginning of the QRS. So doc, you have the expiratory reserve volume and residual volume and the various things. I leave the literature for you. If you combine ERV and RV, ERV and RV, we get FRC. That is what is asked, na? What is given in the image? This is total lung capacity. You have got vital capacity, then you have RV, then you have FRC. FRC comes by adding ERV and the RV, expected reserve volume and the residual volume. Then doctor, a sarcomere has been given to you. The area where actin myosin are having overlap versus only actin area. So what is A band, I band, Z band, etc., etc. You must basically know how to label. Last week we had more clinically oriented questions, medicine, etc. This week we had more basic sciences. So around you can expect 30-35 questions which are image based. We don't know. That was last year. This year what happens to the examiner and his undulating moods, we are not sure. But at least don't wake up from the sleep in a nightmare that 200 questions came image based. If 200 questions come image based, how much will be the top mark, you know? 195. Image based questions are easy to crack. Now along the gut, you have various things which are more absorbed in jejunum, more absorbed in ileum, which are influenced by aldosterone, which are affected by calcitriol. Accordingly, you must localize which specific ion it is the challenge of this question. So fundamentally it is the potassium which is influenced by the aldosterone, absorption of it. Aldosterone not only affects collecting duct, it even goes and acts on the membrane of intestine and affects the potassium absorption in the gut is what you need to remember. What is influenced by calcitriol becomes calcium, and the location where jejunum and ileum are very important for the absorption would be the sodium, and sodium is also affected by the aldosterone is what you have to fundamentally remember. Now doctor, yeah, I leave all the literature for you. Then yeah, gluconeogenesis and glycolysis. You must know what are the things that regulate the gluconeogenesis. You have an inhibitor and a stimulant of gluconeogenesis. So what is the inhibitor? Insulin is an inhibitor of gluconeogenesis. Gluconeogenesis means what, doctor? Production of the glucose in the body. अगर एक चिकन बिरयानी खाए आप तो किसका लेवल्स बढ़ेगा? इंसुलिन का लेवल्स बढ़ेगा when you are in a fat state. When you are in a fat state, does your body need to produce endogenously glucose? No. So somebody should tell body to not produce endogenous glucose when you are in a fat state. So how will that be communicated? Fat state increases insulin level, insulin comes and inhibits the gluconeogenesis, whereas cortisol, glucagon, epinephrine, they are all opposition party, right? So is what need to be remembered. Then in the lipid metabolism, typically what is that which carries the fatty acids in a fat state to the adipose tissue and muscle? I think you all know very well. Exogenous triglycerides are predominantly carried by, which come through diet, chylomicrons. Endogenous triglycerides are predominantly carried by VLDL. So that is what you need to basically appreciate. Then various forms of transport mechanisms. Sometimes you don't need anything, automatically the electrolyte is being driven based on the difference in the concentration levels across the membrane. So what are the various names which have been given? One is called facilitated diffusion, where it is facilitated by one carrier. Then ATP is involved, dahez liya, shadi kiya, active transport. Third is secondary active transport. You marry my sister and I will marry your sister. So one ion is being transported that produces energy like sodium, and that energy is used by the other ion to move in. That is basically called the secondary active transport, is what you have to basically remember. Now in a post-absorptive state, what are the various changes that occur in our metabolic pathway? Fundamentally, starvation feeding cycle is the favorite topic of the examiner. Okay, we have discussed it in our biochemistry available in anatomy2medicine.com video library. If you have done this wrong, today evening only you should review starvation feeding cycle, the most high yield topic. What promotes ketogenesis, how ketone body production occur, etc., etc. Tell me, doctor, which is the only organ in the body which is capable of producing the ketone bodies? Only organ, liver. Tell me, which is the only organ that cannot use the ketone bodies for energy? Liver itself. Who cooks food in the home? Mom. But who is the only one who will be starving without eating? Mom only, because she will be happy seeing children eating food, right? So why liver cannot use ketone bodies? Why the liver cannot use ketone bodies? Can you give me the board? Fundamentally, what are the scenarios where ketone bodies are produced? Starvation, insulin deficiency are the predominant scenarios where ketone bodies are produced. असल में ketone bodies क्या होता है? Acetyl CoA plus acetyl CoA will form acetyl CoA, acetone and beta hydroxybutyric acid. They are called as ketone bodies. Normally, whenever we are starving, who is starving? Peripheral tissues are all starving. They want food. Like the children who came from school, they will say, "Ma, we are hungry. Khilao." Then Ma kya bolega? 2 minutes. And she will break all the fatty acids inside the liver. And what does beta oxidation of fatty acid releases? Acetyl CoA. मगर वो एसिटाइल खोए खिलाने के लिए टिश्यूज को वो एसिटाइल खोए लिवर में तैयार हो रहे और पेरिफेरल टिश्यूज को जाना पड़ेगा. Acetyl CoA cannot float in blood simply like that. It should be packed, like food is packed in the tiffin box. So Ma will put acetyl CoA into a tiffin box, and what is the tiffin box called? Ketone body. Combine two acetyl CoA molecules and make it a acetyl CoA beta hydroxybutyrate and acetone, and then serve it to the tissues. So ketone bodies are the transferable forms of the acetyl CoA is what need to be remembered. Then what will happen after they reach the tissues, they enter into the tissues, they need to be reconverted back into acetyl CoA. Okay, so acetone or acetone or beta hydroxybutyrate need to be converted into back into what? Acetyl CoA. To convert that back, somebody should provide CoA. Who provides CoA? Succinyl CoA provides CoA. That means in the peripheral tissues, there should be one enzyme available which takes the CoA from succinyl CoA and attach it to the acetone and recreate the acetyl CoA, and that will in turn will be used by peripheral tissues. ये जो एंजाइम जो रहता है, जो सक्सिनाइल कोए के खोए को खींच के एसिटाइल कोए को का तैयारी फिर करेगा, रिकन्वर्ट करेगा कीटोन बॉडी टू एसिटाइल कोए, that will be there only in peripheral tissues, but never in the liver. And enzymes required for the ketone body production are present only in the liver, but not in peripheral tissues. Who said God is not there? God is there. That's the reason He planned all these things. So, coming to Sunday is almost like attending a church. So, I have become like a priest, academic priest. Every Sunday, my people say, "Arey, your Sunday means I am not available to anybody until afternoon 3 o'clock." So, got it? Remember, doctor, you will enjoy the subject provided you imagine the patient in that situation. Pulmonary hypertension, mitral valve prolapse, mitral regurgitation. How does the patient present? How do we treat if he comes? What are the cardinal clinical features? Like that, if you think more and more from a patient's perspective, entire learning of medicine will be more interesting. So, but still, whatever it is, we are entering September. Time is on. No time, notification will come. AIMS, PGI, JIPMER, blah blah blah, DNB. You should be ready with bags and packs. So, time that you rise, awake, and sprint before you are being massacred by competition. So, doctor, what is this typical drug which basically acts by acting on GABA-gated chloride channel among the anti-epileptics? Benzodiazepines classically have got an inhibitory effect on the neurosynaptic junctions because of their ability to open up the chloride channel and lead to hyperpolarization which will inhibit the neurosynaptic transmission, and that's how they show the anti-epileptic effect is what you need to remember. So what is this drug that basically acts on the prostaglandin receptor, which is used in the management of peptic ulcer? Misoprostol. Misoprostol is a semi-synthetic prostaglandin derivative, which is used in the peptic ulcer management, is what need to be remembered. So what is the principle about sucralfate and proton pump inhibitors? Sucralfate will coat the gastric mucosa. That's the reason if you are giving any proton pump inhibitor, you are also giving him sucralfate. What is the instruction you will give? At least 2 to 3 hours of gap must be there between sucralfate and the proton pump inhibitor. If the patient takes both of them together, then proton pump inhibitors cannot go and inhibit because sucral is coating the mucosa, is what you have to basically remember. Then what is the drug which is very sensitive to the gastric acid and which is not much effective on the gram negative, but few gram positive like gonococcus, pneumococcus, staphylococcus is effective. So what is that drug which we are talking about? Penicillin is what you have to basically remember. Then injuries of the hand. We have got zone 1, zone 2, zone 3. So which is the zone? It is the middle zone, which is a difficult zone where the pulleys of the tendons for you to repair. That's the reason it is called the no man's zone. Whenever the patient is having a tendinous injury is what need to be remembered. So what is the condition where you do a end-to-side ileostomy, ileoileostomy, and for which condition do you use it? Meconium-ileus, classically. So you must know Bishop-Coop's operation, where the meconium has led to the obstruction of the ileum, then that grossly distended ileum you will resect it, and before the obstruction, the proximal part and the distal part are basically further anastomosed, end to side is the Bishop-Coop is what you need to remember. Now the various lines on the radiograph, Perkins line, Hilgen-Riener's line, etc., etc. So what we are seeing, this angle D, acetabular angle, it is typically more than 20, but after first year of life, not before, is the point of interest. So it takes at least by 1 year 30 degrees and below 25 degrees by 2 years of age. That's a point of interest in congenital dislocation. Now the patient had got trauma. You are clinically examining. You are the house surgeon on duty. So which location, if there is abnormality out of these 3 tests, which abnormal test? This is winging of scapula, serratus anterior involvement, and here there is a injury occurring in the supraclavicular area, which carries the worst prognosis out of all this. Any sensory loss above the clavicle means C3, C4 got damaged. Any damage to the C3, C4 has got an effect on diaphragmatic movement, which in turn will lead to ventilatory failure, which carries a poorer prognosis. That's the reason in the cases where you are suspecting brachial plexus injury, you should not forget to evaluate supraclavicular cutaneous innervation is what you need to basically remember. Now you have an angle which is typically affected whenever there is any deformity in the foot bones. So what is this angle fundamentally is the normal value. There are 4 to 5 normal angle values in orthopedics. Congenital talipes equinovarus, similarly coxovara, coxovalga. To diagnose all this, there are some normal values defined. Similarly, ankle injuries, normal values. So these 4 or 5 values which you need to be quite sure on. Now doctor, lactation is a complex process. Even the cry of baby is sufficient for the mother to start lactating. So there is a hypothalamic involvement. Hypothalamus is the part of our limbic system where emotions are basically recorded. So only pituitary has an influence. So what are the various factors that affect? Thyrotropin releasing hormone has a positive effect on pituitary to release prolactin. Dopamine and GABA have a negative effect. Estrogen has a positive effect on prolactin release. So the various regulators of the prolactin production is something that you need to basically remember. Now you have a substance A which is acting on the myometrium, etc., etc. So what is that substance basically? Prostaglandin and bradykinin. Their effects on the myometrium, etc., etc., endometrium, and what is their role in the shedding of endometrium? All those things you need to be sure. You have been shown a vaginal squame which is showing stippling of cytoplasm because of the cocobacilli which are adherent to it. What is it basically diagnostic of? It is a clue cell of bacterial vaginosis is what you need to basically remember. Now what is this maneuver? One forceps, image based question, one suture material, one needle in surgery. Without that there is no question paper. If you have never gone to the OT also, at least for entrance exam, DAS critical surgery is there, no? Last में instruments रहता, I don't know, the current editions are carrying the instruments are there, no? एक बार review मारना पड़ता आप. When you have gone for your MBBS surgery exam, maybe your sweetest of sweet postgraduate helped you. That whether that is called as dinner fork or what type of fork it is, but whether it is a butterfly or what kind of surgical instrument, he helped. But now you need to help yourself. So what is this maneuver? It is basically called the Pinard's maneuver, which is used to deliver the foot into the vagina in the case of a frank breech presentation. Morrishew Similivit maneuver, then Pinard maneuver, Roberts maneuver, corkscrew maneuver, all these maneuvers you have to identify looking at the image. That's going to be a favorite question of the examiner. Now doctor, the various positions and how do you basically define them? So left occipital anterior, left occipital posterior, based on the occiput, you must know how to recognize posterior fontanelle, anterior fontanelle in the image and accordingly take a call. So they are all the various image based questions.